Since this is the first time we've worked together, I want to know a little bit about where you're coming from, so I know best how to help you while you're here. So this being July, I'm assuming this is your very first rotation.
Yeah, but my preceptors in the first and second year were really, really great, and they let me see a lot of patients, and I got to do a lot of interviews, even by myself.
Good. Any idea yet as to what you'd like to go into?
Medicine, maybe even geriatrics. It's why I wanted to start right away and get right to it.
Well, that sounds great. We can always use another eager young recruit. Let me tell you how I'd like to hear the case. I think it's best if you concentrate on the HPI. You know, what brought them in here, what meds they're on. Do you think you can keep things pared down to that?
What about social history? They emphasize that a lot in my interviewing courses.
Well, of course, the social history is important for our senior patients, but for now, I'm going to ask you to concentrate on function, ADLs and IADLs, and if I need more, I'll ask questions. And we'll add other things as we go along. How does that sound?
Good.
Good. Okay, so tell me about Mr. Chamberlain.
Oh, he was so great. I really liked talking to him. He's 91. I think his birthday was 2 days ago. And he came in last night from, what was it? From his nursing home. It was Sunset Horizons, which he says he doesn't really like living in because he thinks he can still take care of himself, but his daughters made him move there. Anyways, came to the hospital because he was having some fevers for the past 2 or 3 days. And he said that he measured them and they were up to 102, but he was using one of those ear thermometers, so he doesn't know if he was doing it right. He thinks his fever was highest yesterday when he was watching Jeopardy, which was right around dinner time. He said he likes to watch Jeopardy every day at the same time, and he's been doing really well on the questions recently. So, but the last few nights, not as well, because he wasn't feeling very good. And he said, I don't know, he didn't feel hot when I touched him, so I don't think he had a fever. I listened to his lungs too, and he said, well, I listened to them because he said he was having a cough recently, and he said that sometimes there's some yellow sputum, but he complains that he's been having a hard time breathing. He told me he was a marathon runner when he was younger, and he's really sad because now he can't even cross the room. He did say that he had a history of congestive heart failure, so maybe that's why he has shortness of breath. I don't know. There were some infiltrates in his chest x-ray when I looked at it, and in case he keeps having trouble breathing, we can give him some oxygen maybe to help with that. And he's taking a whole bunch of medications for his heart failure. He said one of the pills is small and yellow, and the other one is a water pill. He drew a picture of it for me. It's here somewhere. Oh, here it is. So it looks pretty accurate, but I haven't had a chance to compare it on the physician's best reference, so...
Well, you certainly got a lot of information.
Oh, I loved talking to him. He was so nice and really funny and smart. We started talking about movies. He's actually a Martin Short fan.
Okay, but I didn't really get a sense of what is wrong with him. What's he here for?
Oh, well, he's a 91-year-old male admitted from his nursing home last night with a 2 to 3 day history of fever and cough productive of yellow sputum.
See, now that's how succinct your entire presentation should be. It seems like you presented your entire conversation with the patient. It was confusing to me because elements of your history, such as details from the social history and past medical history, were distracting from the real reason the patient was admitted. Even though your interview with the patient may not follow any particular order, you need to take the time to organize the information when you present it.
Okay, I get it.
Why don't we go back over the physical exam? Give me just the positive findings.
Okay, well, this is a normal appearing older male in no apparent distress. His temperature is 36.8, blood pressure is 116/56, heart rate 84, respirations 24 to 28, O2 sat is 96% on room air. In general, he's in no acute distress. Chest exam, he had an old sternotomy scar, which was well healed. He said it was from a broken heart because his wife died around the same time he had the valve replaced. He has normal respiratory effort. He's clear to auscultation bilaterally with no egophony appreciated. Heart has a regular rate and rhythm, no significant murmurs appreciated. Okay, the room did have a lot of background noise though. Okay. I looked at the EKG. He seemed to have a normal sinus rhythm, rate of about 66. I'm not really good at those though, so I don't know what that means. The chest x-ray was a lot easier. It showed a right middle lobe infiltrate, and this tells me why he was having a hard time breathing, obviously. Now that I think about it, he was sitting up with a lot of pillows when I walked in and he was reading. Probably should have asked if he had to sleep with those, but I didn't.
I think you're still having some problems with identifying what's pertinent in the H&P and organizing the elements so you can present them in a logical sequence. We're going to go together to see the patient in a few minutes, but I want to give you some more feedback as to how you might improve your presentations in the future. Maybe it would be helpful if you make an outline so that you can keep the elements of the H&P in their proper sequence in your write-up. You don't need to bring all these papers with you. Just bring your write-up. If you need to for your presentation, you could always read through it. You could also practice presentations with one of the residents. Do you think that would be helpful?
It sounds good. I really want to get this right.